Today, we're going to talk about something really, really important. We're going to look at how it's actually possible to get safe, medically supervised detox from drugs or alcohol without having to completely blow up your entire life to do it.
This question really gets to the heart of everything. For so many people, the idea of getting help is tied to this paralyzing fear. It's not just fear of the withdrawal itself, but of losing everything you've built: your job, your family, your home. It's this feeling that you're facing a totally impossible choice.
And for decades, that's exactly the choice that traditional addiction treatment has offered. It basically forces you to decide between getting the medical care you so desperately need and holding on to the life you've worked so hard to build. It's a terrible spot to be in, isn't it?
And this really lays out that conflict perfectly. On the left, you've got the demands of traditional inpatient treatment. You have to leave your job, leave your family, put your entire life on hold. But then look at the right side. That's your reality. Your family needs you there. Your job is absolutely critical. This old model forces so many people to just wait, to put off getting help, pushing them deeper and deeper into their addiction, because the cure feels almost as destructive as the disease itself.
Well, it was exactly this impossible choice that sparked a revolutionary new way of thinking, a new path to recovery that isn't designed to pull you out of your world, but to weave healing directly into it.
And this new path was created by Dr. Indra Sidambi. Now, as a double board certified specialist in addiction medicine, she actually used to be the director of chemical dependency at a big inpatient facility. So she saw this problem firsthand every single day. She saw that good people weren't getting the help they needed because they just couldn't vanish from their lives for 30, 60, or 90 days. So she built a better way.
And that solution is called outpatient detox. Now, this isn't your typical outpatient therapy. We're talking about the actual detox part, the serious medical process of withdrawal. It's handled safely by doctors and nurses during the day, and then you get to go home at night. It treats addiction the way we treat other chronic diseases, like diabetes or hypertension. You get the medical care you need without being locked away. It makes so much more sense, doesn't it?
Okay, so this brings us to the most important question of all. How in the world is this safe? We all know that withdrawal from substances like alcohol or benzos can be incredibly dangerous, even life-threatening. Safety is everything. So what does that first day at RecoveryCNT really look like?
The first thing you need to know is that the entire process starts with empathy. RecoveryCNT gets it. They truly understand that the fear of withdrawal is this massive wall that stops people from seeking help. The pain, the anxiety, the physical agony, it's terrifying. Their entire system is built to compassionately and medically manage that experience from the very first moment you walk in.
And this just shows you how committed they are to your comfort. Look at step 3. You meet with a nurse first, not some administrator with a clipboard, not a billing person, a medical professional. They have all the necessary detox medications right there on site, which means that within an hour of arriving, you can start getting medication to ease your withdrawal symptoms. It's all about relief right away.
And this safety isn't just a promise, it's a whole system built on these pillars. Let's just sit with this for a second because it's so important. First, the whole program is led by a double board-certified MD in addiction medicine. That means a top-tier medical expert is designing your specific care plan. Second, the model is recognized by the American Society of Addiction Medicine, that's ASAM, as being both safe and effective. That's the gold standard in this field. It's fully licensed by the state of New Jersey, and so critically, your medication plan is individualized. It is not one size fits all. It's tailored just for you. And all of this happens in a small boutique setting. You are never, ever just a number.
So let's talk about why this actually builds a stronger, more lasting recovery. Because when you don't have to leave your life behind, you learn how to navigate the real world sober right from day one.
The real proof is in the stories from people who've actually been through it. Brandy's words right here, they capture the whole spirit of this model. It's about treating you as a whole person, helping you believe in yourself again, and seeing a real future beyond addiction.
And JR, who's a parent of a patient, hits on two more huge points. The setting is less stressful than being confined, and it allows for family to be involved, which is just absolutely vital for lasting healing. You're not healing in a bubble. You're healing with your support system right there with you.
And that feeling of genuine concern, as Susan puts it, that makes all the difference in the world. It's what builds the trust that a patient and their family need to really dive into the process and believe that, yes, recovery is truly possible.
And it's not just powerful stories. The data tells the exact same tale. Research on this ambulatory detox model shows significantly higher success rates, especially when it comes to getting and staying sober for over 90 days.
So this approach isn't just more convenient, it's actually proven to be more effective.
So, what does this all mean for you or someone you care about? It means that getting this level of expert medical care doesn't have to be some complicated, financially draining nightmare. The entire system is built to be accessible.
And honestly, this is one of the biggest sources of relief for people. RecoveryCNT is in-network with pretty much every major insurance provider in the area. And what that means for many people is that the cost of this life-saving care is minimal. Often, there's no out-of-pocket expense at all. It means high-quality care is truly within reach.
Look, taking that first step is always the hardest part, but you absolutely do not have to figure this all out on your own. One simple, completely confidential phone call will connect you with a team that is just there to listen and help. They offer a free assessment, no strings attached, no obligation, just to help you understand your options. If you or someone you love is struggling, please just make the call. The number is right here, 1-732-484-9661, and the website is RecoveryCNT.com. You are not alone in this.